autosomal dominant and involved in heme biosynthesis, your mind should reflexively think about acute intermittent porphyria. A lot of the times, these questions regarding acute intermittent porphyria have a very unique question stem. Usually, you have a patient with new onset of psychiatric or neurological abnormalities after not eating. And what happens pathophysiologically is you have acute intermittent neurovisceral attacks, and you'll have some unexplained acute abdominal pain. A big kicker would be if they mentioned that family history of similar. And the way you diagnose this is looking through their urine and seeing porphobilinogen. Why does it cause nervous system attacks? We have no idea really. They believe it has something to do with altered enzymes. And when you have carbohydrate restriction, this induces enzyme synthesis and you have neurovisceral attacks. Now remember, because these are neuro attacks, when you palpate on their abdomen, they tend to not have any abdominal tenderness. I also mentioned this back in the pheochromocytoma lecture, I believe, because sometimes these patients have anxiety and insomnia, they can't sleep, sometimes they even have psychotic symptoms, and the age of onset is 20 to 30, and again, pheochromocytoma is 30 to 50, so sometimes these stems can be kind of tricky and you might have to think a little bit longer. Lyme disease can sometimes present very similarly, but remember that abdominal pain and sometimes that psychosis that happens rarely ever happens in Lyme. Now, if the patient doesn't have any abdominal pain and they've had psychotic symptoms for 6 months, you better be thinking about schizophrenia as a possible differential. Sometimes if this quote-unquote abdominal pain is more right upper quadrant, you can also think about Wilson disease, but remember, they almost always have those corneal copper deposits. We call those the Kaiser-Fleischer rings.